Alexa, volume 1. Hey!
Hello.
How do I get you onto a bigger screen? 1 second. You're very small down there.
Come on. I am, because I'm sat down.
They've put you in a tiny box. How are you doing?
I'm good, thank you. How are you?
Doing a lot better. I'm getting stronger every day.
Good. Do I see a dog in your lap,
Yes, this is Bella.
Bella? Doesn't your tummy tuck hurt?
No. It's it was really hurting to cough and laugh and sneeze. And then the last couple of days it's been like non-existent. It's okay. But she's on my knee, she's not on my belly, so I'm okay.
I was just thinking, make sure you're not lifting her up
Yeah,
too
I
much.
won't lift her up. I'm not lifting, don't worry.
I just came back from a dog walk actually. My friend here, my dog died, and but my friend here got 5 dogs.
Wow.
And I usually borrowed 5 dogs to go for a walk, and I was like going, I have to pretend I have one. It's just such a beautiful day. So I'm not going to waste it.
Are you in Scotland?
Would you believe? Yeah.
Oh,
Have you ever seen anything like it? Look.
Wow, that's gorgeous, isn't it?
Skies, clear blue skies. We were saying, when was the last time we've seen clear blue skies in Scotland?
Exactly. That's actually mental.
Yep. What's it like down south?
It's been lovely until about half an hour ago, and now it's gone really cold. It's really unpredictable, as usual.
I'm like going, this is unbelievable. Today wasn't supposed to be nice or anything either. No. So yeah, I'll take it and when I can get it. So I'm here for the next couple of weeks before we have the consultation days in Liverpool and Edinburgh on the 15th and 16th of June. And
so
after that,
here until then?
Hopefully. I'm doing the Cannonball Rally this week. On Wednesday, I go to Ireland to Cannonball Retro Rally. It's basically driving old cars around the country.
Oh, wow. I bet that'll be cool. Are you going to drive in an old car then?
Yeah. We have a BMW, very old BMW, probably older than you. So
probably.
And I'll be sharing some pictures from Ireland, and I'm doing the Limerick consultation day on Wednesday night. So it's a busy. I'll try to kind of do the work and then go and enjoy myself for a couple of days and do the work again. Yeah. So
wow. It's going to be a busy week for you.
So it's nice to see you doing so well. And I've seen your pictures today you sent into the group. You're looking fantastic. Are you happy with it?
I'm so happy. Like it's just mental. Like, I didn't think that I'd be healing this quickly. So like I thought I was going to be laid up in bed, not able to move for a couple of weeks, and actually, like I'm okay. And like the results after I took my tapes off, I looked in the mirror. I genuinely had tears coming down my face. I was so happy.
I'm so glad. You were prepared for the surgery, right? You literally taken all the instructions to the T, and you've done everything as you should. And just like I said before, make sure you're not lifting anything right now, and you're still having enough protein to look after you. And you're also
I'm having steak for breakfast every morning, keeping my protein up.
Really? Oh. That's a bit extreme, but hey,
I'm obsessed with meat, so
good. It's always difficult, if you don't like the meat, but it is if you can. I mean, I can have a steak for my breakfast, dinner, and lunch. So so just answering, and we will answer the questions if there is any. Is there anything that you would like to type?
Has anybody got any questions? I don't think we've had any so far. If anyone's got any questions, throw them our way.
Cool.
Can I ask if you do nose jobs?
we do.
Fantastic.
Yeah, with the nose jobs is different. So you arrive the day before, and we have a simulator. So basically, you go into the simulator, and you actually explain exactly, basically, what you would like and what shape you would like.
Okay.
And then once basically both the surgeon and you decide what you would like, and then the next day it will be for the surgery. It's generally 7 days that you need to stay in Turkey. So if you're coming for a nose job, we ask you to come for 8 nights, not 7 nights. So because we can use the first day to go and have the consultation face to face with the surgeon and decide what you want.
Are you asleep for a nose job?
Yeah.
Okay. I didn't know whether it was local or the other one. Local anaesthetic, and there's the other one. I can't remember the name. General, that's the one.
No, local anaesthetic and a general anaesthetic. I mean, I had my nose, so mine is done, but I'll share my befores so you guys kind of can see exactly what it looks like. I mean, with mine, I was scared. I waited till I was 40 to get mine done because I was scared it was going to hurt and I was going to be battered and bruised. And but that's why I didn't go for, when I had mine, I didn't go to be broken. It's still a little bit, like this because I didn't want my bones to be broken and rebuilt. I just wanted to be just the bump to be taken and then, the tip of the nose kind of to raise a little bit.
Yeah. Okay. Can you breathe through your nose straight away after a nose job? I've never even met anybody with a nose job.
It's funny because you have the tampons in, and you, because I couldn't breathe at all from my left nostril. Okay. Oh, I can actually breathe better than I was able to breathe before, even though I had the tampons in. And so when they take out, it's a horrible. What's the smell?
Yeah.
I don't like. And horrible. What's the smell? I can't describe. But one thing I didn't like is a constant. I felt it. Oh, I can smell it in my mouth. And like you're talking through, your backside because it's not basically you are smelling things and we have actually had to work in there, so it's been blood and everything. So that's the only bit I remember not liking. But apart from that, I actually wanted to go not skydiving. What's it called? Paragliding.
Paragliding. Wow. Okay.
Basically took a picture of the paraglide in the mountain that I was at in Turkey in Fethiye. And I sent it to my surgeon and I said, do you think I could do this? And he was like going, no, you need to get back to the car and stay there. Don't do anything. Yes, basically, if you're talking about, can I ask if you do jobs but not botched ones? I can see what you're trying to do and I know why you're doing it, and this is not the platform for you. I will go live on my own profile. You can ask any questions and I will explain what's botched and what's not botched and what needs a revision, what doesn't need a revision, and what you have to do to look after yourself, not to need any revisions. So
has anybody got any other questions?
Yeah, but I was going to, would you explain, the people, obviously, people after bariatric surgery, Megan, it's different. It's different than, basically somebody who just had babies and having a mommy makeover.
Yeah, definitely. So obviously, I started at just over 25 stone at my heaviest. And losing 14.5 stone, I had so much loose skin, like a lot more loose skin than you'd have if you'd just had a baby or a couple of babies. My boobs were down here, my stomach was hanging down. I've got a little bit of wobble on my arms, like it was everywhere, and it was like carrying around this heavy skin around my stomach, and it was just making me depressed. It was awful. So being able to go to the health store and then take that away from me has just been like life changing. It's so insane. And I would say, obviously, losing that much weight, it is a different experience to if you'd have had the skin removed after having a baby, because the weight of it, there is a lot more skin usually.
Hmm. And when people are able to just be able to do that with a mini tummy tuck, yours is kind of extended because
Yeah.
we decided your back doesn't actually need anything. Your back doesn't have rolls.
Yeah,
You don't need.
I've been lucky with my back. Yeah, that's a good point. So obviously, if you were having a tummy tuck after a pregnancy, usually it'd just be like a small incision, whereas I've had a big one around here and one straight up just to pull it all in because they've had to remove so much skin.
Hmm. It's we kind of looked. We would have kind of advised you. We had ladies that we did the back lift and the arm lift before we do the front, and but if basically your front is bothering you more than your back and your arms, so you basically choose the combination of the surgeries. So when you lose 14.5 stone, 15 stone, you should know it's never going to be one surgery, one session, and you're going to get sorted if you have problems at your back. We talked about it with you, and we, basically the only thing, if you even bothered about it, is kind of like the lower back lift, just to pull your bum up a little bit. You don't need a BBL. It's just a case of, just to, pull. But that's just being oversensitive about your body.
When we went into the consultation, I mentioned that I hate my bum, but I think the fact that I'm going to go to when I'm allowed to go to the gym in about 6 months, I'm going to go and try and build up my bum before we try and lift it, because honestly, I do think I could probably just do it in the gym, and I'm being lazy at this point. And if there is nothing I can do in the gym and it's not working, then I will come and get the back lift.
Yeah. No, obviously a rush. And do you want to also talk about the what you had done?
Yeah. So
That's what you decided to do.
So initially, when I came to the health store, I had dreams of having some massive implants put in. And initially, I was just going to have an extended tummy tuck. And then when we got there, we had a consultation with both surgeons. There's 2 surgeons, and it cuts down on the time. And they said that because of the skin here, the health of it wasn't great because of the stretch marks, because of the amount of weight I'd actually lost. So they said that I would be better off having an uplift, that because I had enough tissue, they thought I'd be happy with the size. To have an uplift first, and then if I still wasn't happy with it, go back in, say, 6 months or a year and have implants put in if I really wanted them. And then also with the tummy tuck, we discussed that if they did just do an extended tummy tuck, I was still going to have loose skin here, and I wouldn't be happy with it in the end. So we went for the FDL in the end: a Mons lift, muscle repair, and a uplift without implants. And when I woke up and I looked down and I saw the size that they actually managed to get out of me with my boobs, I was like mind blown. I didn't think I had that much tissue, and I don't actually think I'll go back for implants now. So I'm so glad that I actually listened to them, to be honest.
It might change because it's still new, and you might still have swelling, and the swelling goes down, and you want your implants. You can always, as you said, after 6 months, you can always come back and get your implants done.
Yeah, definitely. And now if I want them, I can come back. But to be honest, thinking about it, I was probably being a bit ambitious with the size that I wanted, and wanting double F boobs on my frame probably isn't that sensible, and I'd have really bad back pain after I felt the weight of those implants when we were in the surgery.
I think that's when you kind of thought, oh, hang about, am I really going?
When you passed me that massive implant, I was like, oh, okay, maybe I don't want to carry 2 of these around for the rest of my life.
But it might change, for right now, I think the right thing, because obviously how you're healing, how neat the surgery is, your scarring, what I've seen this morning, it's really neat and perfect.
Yes.
It might actually change. You might change your mind in a year's time.
Yeah.
Instead of having, complications after surgery. This is a better way of doing it, but, taking advice from the professionals. I mean,
Yeah.
I'm no surgeon. It's just taking advice from them and doing what they tell you to do rather than just want to go your way.
I'm just so glad that I listened to them and took their advice, because I know now, looking at the skin wasn't healthy. So if I had had implants, I probably would have had complications down the line. They might have stretched, or you never know. So I am glad that I've listened to them, and I can always come back for implants when now my skin's healthier.
What basically was clear with you, even though you lost weight so neat everywhere else and you haven't got an ounce of fat on you, you had the skin on the belly, but your breast tissue was still there,
Yeah.
for them to make something of it. So I think that was the key thing. They can't do that by looking at your pictures, and they can't do they know immediately when it's just skin left, and anyhow we're gonna have to do implants for this patient. But and also they need to feel the skin quality as well, how the skin quality is.
Yeah.
So I think as I said, is there, the option there, and basically we're going to do just watch you now how you recover from here. If the swelling goes down and they get smaller, yeah.
Well, I'm just going to follow their advice down to a T and see what happens. But so far, so good.
Okay. How are you finding your support group right now, with the advice and everything?
Oh, it's the WhatsApp group.
Yeah, WhatsApp group. Yeah.
So anything I need, I just throw it in that WhatsApp group, and somebody gets back to me maximum about half an hour. Like, it's really quick, and there is quite a few people in there as well. So if one person doesn't know, the other person does. And if you put a question in there, it just gets sent straight to the surgeon, which I found really helpful. I was being a little bit paranoid about my belly button, which I now know is fine. But I looked at it and I was like, oh my God, is it a bit red? And they sent it straight off to the surgeon, and 10 minutes later he replied and said, just keep an eye on it, carry on sending photos through, and it's just so helpful that I've got that.
Okay. So we talk about a little bit, you had your surgery. Obviously, you don't stay in the hospital for the all 7 days that you're in Turkey. You went to the hotel. How did you find that bit? Did you was it a struggle, or was it something you could cope with, or how did you find a medical pack? I mean, that's the kind of things that I would want to know. What am I sent? What am I sent to hospital with? The hotel with from the hospital, and is that enough?
Yeah, right. So when I left the hospital, it was like I had a new lease of life, because I'd had my drains taken out. Those drains felt really restrictive, because I was carrying them round. And as soon as I had those whipped out and like I was just laid there, I was like, right, okay, I can get up, I can walk now. And then I went to the hotel even, and it was a really nice hotel. And I had the option of having a wheelchair. There was a wheelchair at the hotel, but also you guys provided one as well. And it was really nice just to be able to get a fresh air and out and about. But because was there maybe 2 or 3 days post-op at that point, I was still a bit tender and a bit sore. But it was nice to be able to lay in a hotel in a nice bed and just relax and get some nice food. And then Matt took me out in the wheelchair quite a bit, and we had a walk around Izmir. And at the end of the week, I felt ready to go home. I didn't feel like, oh no, I'm still too tender to travel. I felt ready to go. Because I'd had a nice relax in the hotel, and I just felt like everything I needed was in that bag. So before I left, I had the medicine bag that you gave me, and it was like a big square bag full of dressings, creams, antibiotics, painkillers. And then I had the pamphlet with everything I needed, the leaflet with everything I needed, like step by step. And I knew if I needed anything, I could just go onto the WhatsApp group and ask you guys, and you were really on it. Like anything I needed, I was getting replies so quickly. But yeah,
That's something we do for everybody, as well as having somebody at the hospital, literally 24/7. They do 3 shifts, so they go around the clock in 3 shifts. So we have somebody in the hospital every day, 24/7, literally Monday to Sunday, every day. And obviously when you go, there is somebody always awake. You know, if it's not your booking coordinator, it's the person who is in the hospital on the shift. And if it's not the nurse, you got the Rachel, who lives in Manchester. But, you know, we have, you know, clinics, wound specialist clinics here that will help you out if you need any helping out. But your medical pack is there for a reason. It's there to be able to take care of yourself properly and not having to go to anywhere else to get anything. By the time you're leaving the hospital, you might not need the antibiotics, but if you do something untoward and you do need it, you have it covered there. And you have the wound creams that you're using right now. When the wounds are healed, you're going to go on the scar healing, you know, scar healing creams and gels. So they're gonna, you know, kind of get this scarring as minimal as possible. But for now, what you can do is high protein diets, especially for sleep patients, multivitamins, and also drinking lots of water.
Another thing that it seems small, but when you guys added Matt into the group chat, I also found that really helpful because he obviously knows now everything that I need to do, and he's very good at sticking to things like down to the T and making sure I stick to all the rules. And it's quite helpful that he can see all that and can see my treatment plan in the WhatsApp group and what I'm meant to be doing. I found that really helpful.
Yeah, that's from a learned experience. And also basically when people say, you know, when every time the nurse and doctor comes into your room, there was an update in the group. You had which painkillers you had, which medication you had. So we basically have a copy of your order that is being prescribed by your doctor. You know, with us, so we know what you should have and you shouldn't have. Obviously, in hospitals, you're not their only patient. The nurses got lots of other patients to look after, whereas we don't. We only have our patients, and we can just keep an eye on what you need and how that is being put across. So, you know, Matt being there also knows what's happened, so he knows in 4 hours they're going to come again. He knows, you know, this is going to happen. So instead of waking up and in the middle of the night going, what the hell is going on? So he's done actually quite well, isn't he?
Well, when I woke up from the anaesthetic and I just wasn't with it, I woke up and Matt was like, oh, it's okay, the nurse is going to be here in about half an hour. They've put it on the group chat. And I was like, how do you know? Because I didn't even know he was in the group chat. And he was showing me, and it was really helpful just to keep him like knowing what was happening.
So obviously we didn't, you know, we filmed your surgery because obviously that's what we did. But for not for everybody we do that, but you have a thst Turkey staff going to the surgery with you there till you fall asleep, and they bring you back. And you know, that is basically the standard for everybody. That's not something we did specially for you. So
that was really helpful. When I went down for surgery, they weren't quite ready to take me into the operating theatre for about 5-10 minutes, and she sat with me, and I was really nervous. And she was just sat talking to me and calming me down, and it did really help when I went in. And the last thing I remember is her and Dr. Osman like talking to me. And she had her hand on my face and she's like, it'll be okay, it'll be okay. And it was soothing, and it really helped me just knowing that she was there.
Who was it? Was that Esra or Nehir?
She's got curly hair.
Oh, Bushra.
Yeah, Bush, that's her.
Yeah. Yeah, she's fantastic.
Yeah.
And you know, she has a amazing experience, hospital experience, and she used to work in another hospital. Even though she looks like 12, she's
She
been
does look quite young.
she has been working since uni. She's been working in an hospital, so he knows exactly what happens, and also a legal translator of medical translator. So you know, anything basically we done in she was in the other hospital that we used to work in. She's done our medical translations for the last 3 years. So amazing team. I mean, I love the girls. So I shouldn't say I don't like the boys, because the boys were in Antalya when you were there. You didn't see them. So
well, actually, another thing that I found amazing was when, do you know, when on the last day when I came to the offices to do a little bit of filming, is it Ezra?
Yeah.
He offered to do get an X-ray done of my teeth, and I've always wanted composite bonding. And he got the dentist out to have a look at my teeth and said, well, what do you think of her teeth? And would you put veneers on or composite bonding? And she came out and looked at my teeth, and she said she wouldn't do anything to my teeth whatsoever apart from whitening. And I've found that I've been to 3 consultations for other dentists in Turkey and said, oh, I want composite bonding. And all 3 of them have said, yeah, that's fine. We'll do it for you. We'll do it for you. But the fact that she said, no, you don't need it. You just need whitening. It like really showed that she was just doing it for she had my best interests at heart, rather than just, I'll take your money and I'll do whatever for your teeth.
I always say this, and I always say it out loud. There is going to be a lot of young people who's going to need to get this zirconium crowns or composite bonding changing within, obviously with zirconium crowns, they'll go for, 15, 20 years. But, by the time they're 40, they just had kids and everything. If they don't have the extra cash, and they ruin their teeth. Basically, Dr. Sevtap has been around, obviously. She's been a dentist for the 32 years. She knows exactly what she's doing, and she wouldn't touch a teeth that doesn't need to.
Yeah, well, I was ready to hand the money over and say, do composite bonding. And both her and Ezra were like, no, you don't need it, so don't do it. So that's good enough for me.
Yeah, also doing medical tourism for the last, 5 years. One thing, I mean, we're still learning. Every day is a learning day. And one of the things I said to Dr. Sevtap, sometimes, we end up doing things because, aesthetically, medically, we won't do anything if it's not the right thing to do. But aesthetically, we have to go with what people want. The shade of white, if you want that white, that's what you got.
Yeah.
And if basically you want your goofy teeth, and that's basically what you came with, that's what you got. I mean, we had a gentleman, literally 2 days. He sent his group. He's been researching the teeth that he wanted.
Yeah.
And we all looked at it and gone, oh no, are we going to do this? Yeah. But he said, this is what I want.
This is what I want. You can't, you can't say no.
Medically, you do what you have to do, but when it comes into the aesthetics, you have to do what the client wants, because you haven't, it's their right to have whatever they want, and not my decision to think, oh, this is what it will suit you. I mean, like I said, after you're healed, if you want your double Ds and double Fs, it's your choice, it's your body. You can obviously do whatever you want with it, and knowing full well what basically happens.
Yeah.
So,
and it'll probably be a more simple process, won't it? If I did want the implants, then it would be less surgery than if I'd have done it before.
Oh yeah, like you'll be in and out in an hour and 45 2 hours, and it's just a case of making making a place for the implant and placing it, and obviously again that's for the surgeon to explain. But for me, it is it's more straightforward than dealing with oh my god, I just remembered your excess skin.
The big hold up of it.
I will never forgive them for that, because that's one thing that I can't see, and because once you see it, you can't unsee it.
No, it was something.
And they sent it to me. I was like, why did you do that? I mean, I'm in this group. Do it in the other group where I'm not in. You can send anything.
Sending it to all my friends. They all hate me. I just send it around because I think it's funny.
Really? Oh my god. Emily.
Yes, Emily did get sent it.
See. I don't think you should be scarring people though.
Well, she's had other surgeries that I've seen. It's fine.
Right. Apart from that, is basically what else? I'm just thinking throughout the process. That's what we can think about. I mean, obviously, God, no smoking and no drinking alcohol, and just basically doing what you're supposed to do. So that's you haven't smoked. And did you vape?
Pardon?
Did you vape before surgery or no? You don't smoke, do you? That's perfect. I mean, that's what your skin is so good. I guess. So apart from that, I don't have anything. I'm just looking forward to your healing process now, and how you get on, and hopefully we'll see you in Turkey, but not for surgery.
No, yeah, hopefully we'll definitely be coming on holiday soon.
Yeah. You liked it in Izmir, did you?
I loved it. Yeah, it was beautiful. I want to explore further when I'm not crippled and in a wheelchair.
And Matt, bouncing you around in a wheelchair.
Oh, no. He had me in the middle of 2 lanes of traffic and just didn't know what to do.
Well, maybe we'll find a better driver next time.
Maybe.
I can't, because I'm outside and it's on your white shirt. I can't really see. I can't really see what goes on.
What goes on? Is that better?
Oh no, not that. No, but, yeah, that black is better actually.
Is that better? We can do that.
I'm blind as a bat, I tell you. It's my age. It's getting there.
Now you've got my white skin.
Yeah, and you came back from Turkey probably one holiday. You never got any.
I was still as pale.
Yeah, that's another thing. No sunbathing and no. What do you call it? What do you call them? The beds that you go on.
Sunbeds.
Sunbeds.
Yeah, I can't go on them anyway. I just get burnt.
Yeah, good. So that would be perfect. But I mean, for me, that's it, and we'll catch up again, obviously. Okay. Yeah. Thank you for having me on.
Yeah, no worries. We shall speak soon.
See you soon. Bye.
Bye. I don't know how to get rid of you, so you might have to do it yourself.